Hello, and welcome to part 8 of Innate Immunology. We are looking today at inflammation. I'm going to show you just a real quick video that kind of shows inflammation, and then we will go through the different steps of it. So that was just kind of an interesting way to see the inflammatory process. But here we have some diagrams, and let's talk a little bit more detail. And the inflammation is the primary immune response that occurs, and this is either from injury or damage, or more often than not through the introduction of some kind of pathogen. The inflammatory response triggers for it are MAMPs and DAMPs. We saw these when we talked about, I'm sorry about that. We saw these when we talked about the pattern recognition receptors. So inflammation is tied to those same signaling type of molecules. So those microorganism or microbe associated molecular patterns, or tissue damage, which would be damage associated molecular patterns. Now here we have just kind of a quick 4-step process here in inflammation. Here we have a breach, something happens, somebody gets stuck with a pin, and on the tip of that pin were some bacteria. So not only do we penetrate through the first line defenses, the epidermis and dermal layers, we also move down into tissue. So now we're going to see some secondary responses. Between complement, neutrophils, monocytes, we see white blood cell activation. These guys, as they are responding to this is causing vasodilation. We'll talk about that in a minute, which causes fluid leakage. You can see there's a lot of cellular activity going on around here, which is going to cause heat. And then we have leaking of some red blood cells that will also happen in this area because of damage and because of our inflammatory response. So that's going to cause swelling and redness. So heat, swelling, redness, and pain are oftentimes associated with the inflammatory response. As the bacterial infection and everything starts to get under control, we can see that we have clotting, damage repair. Different cytokines are causing, like colony stimulating factor and such, are causing an increase in mitotic activity. We're replacing damaged cells, those sorts of things. And the membrane, the cell begins to heal up, and the wound itself is starting to close up, and less damage is prevalent. Now, a key component in this inflammatory response is a process known as extravasation. It's also more commonly called leukocyte rolling. And leukocyte rolling is really quite amazing. White blood cells will roll and kind of stick on the inside of venous tissue. This only occurs in veins. And they'll roll along the inside of these blood vessels. And when there's damage, like we see up here, notice these little yellow dots, these are all cytokines that are being released and will be received by these endothelial cells. These endothelial cells will do two things. One, they'll pop up receptors here that make white blood cells stick to them. they will also loosen up the cadherins in between them that form tight junctions to allow relaxation to occur between these the two cells here, and this allows room for white blood cells to migrate out of the blood vessels into tissue. This extravasation here, or a diapedesis, which is what they're looking at right here, this very process here is how red blood cells escape. They'll escape through this loosening in here. Some plasma will escape that can cause increase in size or swelling. And this process is part of the inflammatory response and how we get our white blood cells to respond to a tissue damage or a tissue type reaction. This overall process of all of this relaxation in the venous tissue is called vasodilation. So vasodilation causes this relaxation in the blood vessels for white blood cells to migrate out. This is sometimes referred to as leukocyte emigration. And that is because these blood cells are moving out as opposed to moving in. So this extravasation process right here is shown, and I want to take you back to, we talked about very early in this lecture, we talked about some adhesion. Right? We talked about adhesions, and I said those were going to come back up. Adhesion molecules, you can see them here. One, we have cadherins that occur between blood vessels here, which form tight junctions. Tight junctions are necessary to prevent leakage, and this is why blood vessel endothelial cells in blood vessels have tight junctions. But then we also have selectins. Selectins are proteins that will pop up on the surface of the endothelial cells, and they will interact with integrins that will be found on the surface of our white blood cells. So different classes of selectins and different classes of these adhesion molecules play a really big role in leukocyte extravasation or leukocyte rolling. So here's just a quick video that's going to show you this process in action.
Leukocytes are white blood cells that help fight infection. At sites of injury, infection, or inflammation, cytokines are released and stimulate endothelial cells that line adjacent blood vessels. The endothelial cells then express surface proteins called selectins. Selectins bind to carbohydrates displayed on the membrane of the leukocytes, causing them to stick to the walls of the blood vessels. This binding interaction is of sufficiently low affinity that the leukocytes can literally roll along the vessel walls in search for points to exit the vessel. There, they adhere tightly and squeeze between endothelial cells without disrupting the vessel walls, then crawl out of the blood vessel into the adjacent connective tissue. Here, leukocyte rolling is observed directly in an anesthetized mouse. The up and down movement of the frame is due to the mouse's breathing. Two blood vessels are shown. The upper one is an artery with blood flowing from right to left. The lower one is a vein, with blood flowing from left to right. Leukocytes only adhere to the surface of veins. They do not crawl out of arteries. Some leukocytes are firmly attached and are in the process of crawling through the vessel walls, whereas others have already left the vessel and are seen in the surrounding connective tissue. When the blood flow is stopped temporarily by gently clamping the vessels, we can appreciate how densely both vessels are filled with red blood cells. Red blood cells do not interact with the vessel walls and move so fast under normal flow that we cannot see them. When the blood flow is restored, some of the leukocytes continue rolling, whereas all non-interacting cells are immediately washed away by the shear.
Okay, that is actually one of my favorite videos in this class, just because I find that process utterly fascinating and how our bodies can respond in such a way to cause that localized. Now, an important concept in this is that that's a very localized reaction. If we take a look at this diagram here, which is basically showing the same thing, these microbes are in one area. If this were that cut that we saw on the image before, the microorganisms are in one area, and this is how we can see a localized immune reaction as opposed to every single time we get a splinter having a systemic immune reaction. So this use of cytokines and cell damage signals, the signaling of microorganisms, it's letting the immune system know where the problem is, so it can be very targeted and local as opposed to trying to do it systemic. And you can see with the severity of these reactions, if this is occurring in the bloodstream and we have this on a system-wide scale, then now you're looking at a really big problem, right? You're looking at vasodilation throughout the entire circulatory system as opposed to just vasodilation in a local area. So inflammation is one of the very first things that has to occur in order for our immune system to respond appropriately, because our white blood cells, our neutrophils and the the monocytes and dendritic cells, they can't necessarily get to where they need to be if they aren't able to get out of the bloodstream. What's the point of having them circulating throughout the body very quickly if when they get where they need to go, they can't get to the actual, they're kind of stuck behind a glass wall. So that vasodilation and leukocyte rolling type of activity is really a fascinating part of the immune response. So inflammation occurs, we have two different types. We have acute and chronic inflammation. Acute inflammation is very short term. This is what you would feel when, say, you twist your ankle or an acute bacterial infection. The onset of inflammation is usually very rapid, maybe a couple of hours or a day. It is intense. It is a very painful form of inflammation. It includes redness, heat, and swelling, and a high concentration of neutrophils are associated with acute inflammation because neutrophils are those phagocytic cells that are going to respond very rapidly. And we have a high concentration of neutrophils compared to other white blood cells as well, so neutrophils are going to respond first. Here on the right, we have a diagram just kind of showing you the different things that will initiate acute versus chronic. So irritants, allergies, infections, trauma, cuts, frostbite, burns. These are all injuries that would cause some form of acute inflammation. Chronic inflammation is a little different. It's long-term. It's usually very low level. It oftentimes is the result of extended acute inflammation, but it's not nearly as intense. It's just kind of like, kind of a slow stream of inflammation over an extremely long period of time. In chronic inflammation, instead of an excess of neutrophils, because the chemical signals being sent out are different, we're going to see an excess of macrophages. So this might be seen in say an aspirate biopsy or something like that. They're going to see a lot of macrophages in tissue, not a lot of neutrophils. Again, there's a much lower pain level associated with chronic inflammation, but there's oftentimes long-term damage, and the pain level is lower, but it is nonstop. It's constant. So chronic inflammation is a really big problem in a lot of different disease states, right? We have lupus, chronic fatigue syndrome, neurological diseases, cardiovascular, rheumatoid arthritis, cancer. These are all different types of conditions and diseases that chronic inflammation is associated with. So damage. Inflammation, especially chronic inflammation, can cause some long-term or permanent damage. Pro-inflammatory cytokines in cells can be toxic to healthy cells if they're released. So if we have a phagocytic cell that breaks open or is damaged, it can actually release its own toxins. The severity of the consequences from inflammation is going to also be directly related to where that inflammation is occurring. Is that inflammation occurring on skin? If it is, that might be irritating, it might be painful and such, but it's certainly not the end of the world. But if we have inflammation occurring in the brain due to some kind of traumatic injury, that's a much different situation. So not only the severity of injury or infection, but also where that actual injury or infection has occurred in the body plays a role. There can be very severe effects from infection, including long-term tissue damage and organ damage, usually due to some form of toxin. And is our inflammatory reaction localized or systemic? And this also has to do with hypersensitivities. Inflammation is associated with anaphylaxis. So just to review, make sure you know what inflammation is, the three common, signs or symptoms of inflammation. What is leukocyte rolling? Know the different steps when we talked about diabetes and leukocyte extravasation. How are adhesions and selections associated in the inflammatory response? We want to relate that back to when we were talking about different types of molecules in innate immunology. Make sure you know the differences between acute and chronic inflammation and what type of damages can be caused by it. So that's the end of the inflammatory, and we're moving on to part 9 next.